So think about this for a minute. I'm not going to read through this. Hopefully you had time to read through it already. So think of, if there was this form of alternative medicine that didn't really seem to work. If it did, it's probably due to the placebo effect. And it doesn't. It probably is worse for you than it probably causes more harm than good. Would you want to give it to your kids? Would you experiment it with yourself? Um, just think about that. And think about that this is what we do in our culture, unfortunately. So, just kind of on a side note, the first time I showed this to my wife, she was like, "You cannot show this to your students. This is too depressing." But it's the light at the end of the tunnel is that things are changing, fortunately. And of course, this is a very um, cynical viewpoint, I guess, of psychiatry. I know that there are obviously some very positive aspects of psychiatry, but we're going to take a look at some of the concerns about some of the standard practices and some of alternative approaches that seem to be as effective or more effective, and certainly healthier in the long run. Okay. So there was a paradigm shift in maybe second half of last century, 1950 or so. They started to move away from Freudian view of mental illness to more of the biological paradigm that mental illness resulted from chemical imbalances in the brain. Um, and everything came to, it's a chemical imbalance. This was kind of convenient, especially when you consider that the pharmaceutical industry had started to develop drugs, which of course targeted chemicals in the brain, neurochemistry. So, rather than listening to the patient's whole life story and try and figure out, Freudian psychology is pretty complex, obviously. Um, you could just, give them a drug, and it was nice and quick, and you could treat many more patients. Uh, and of course, it worked out well for the pharmaceutical industry. So, very strong financial ties developed between the psychiatric community and the pharmaceutical industry. So, the pharmaceutical industry has pretty strong financial ties to every aspect of medicine, but no branch of medicine has a stronger link to the pharmaceutical industry than the psychiatric community by far and away. So there really are no tests for mental illness. You can't do a blood test and determine that somebody has a mental illness. Diagnoses are very subjective. So you go to one psychiatrist for the most part, and you present a set of symptoms, and it's pretty much based on what their opinion. And of course, it's an expert opinion, but it's based on their opinion about what they think. And oftentimes, psychiatrists will disagree on what the diagnosis is, what drug they should use, and 25% of kids are taking a prescription drug every day. More than half of those are psychiatric medications. So there's been a crippling epidemic of mental illness in this culture. Um, there have been so many people disabled by mental disorders that qualify for federal assistance. It's increased by almost 2.5 times between 1987 and 2007. For children, there was a 35-fold increase, in the number of children being put on federal assistance for mental illness. That's nuts. I'm sorry, that's not a appropriate term, but like it just exploded in the past 20 years or so, 30 years, I guess, almost 30 years, 25 years, and it was because children were being diagnosed with illness, being put on drugs, and essentially becoming disabled. They couldn't do anything. It's the leading cause of disability in children. National Institute of Mental Health. So the National Institute of Mental Health is a division of the National Institute of Health, which is a government-funded agency. They conducted a large survey. They found that almost half of the randomly selected adults met the criteria established by the APA, the American Psychiatric Association, for having at least one mental illness. So we're going to talk about the APA a little bit and the DSM-5, I think they're up to now, whatever the new DSM is. It's so kind of vague in some cases in describing the conditions of particular mental illness that almost half the population would be diagnosed as being mentally ill by the APA and the DSM. Uh, with the new update, it's probably more like this says 46%. It's probably closer to 55 or 60. Anxiety disorders, mood disorders, impulse control disorders, and substance abuse disorders are the main categories. So the shift from psychotherapy, to the use of drugs coincided with the theory that mental illness resulted from chemical imbalances. That theory has never been validated. We'll talk about that a little bit more. Uh, this is kind of depressing, so you can kind of skip. I'm not going to talk through this. You can read through this if you want. It's just a kind of an unfortunate thing that happened to a child that was on psychiatric medication. About 5% of kids now in the U.S. take antidepressants. About 10% of 10-year-old kids are on medications for ADHD. Children as young as 2 are being diagnosed with depression and ADHD, and they're being treating with drugs that have never been approved by the FDA. So the way it works is that these are the drugs that are being used. Obviously, asthma is still number one, um, but we saw already that diet can have a big impact on asthma. There's some stress management things that probably work as well. Some kids are still going to need medication even if they're on a perfect diet. Um, but a lot of kids probably we could cut back on that if we ate a little bit healthier. ADHD is up there. Antidepressants, antipsychotics, antihypertensives, which I forget why they give that. I guess that's anxiety, maybe, possibly. I forget what those are for. Sleep aids. A lot of times, kids that are, especially if they're on, ADHD medication is essentially speed. It's amphetamine, so sometimes they need sleep aids. And then statins, believe it or not, high cholesterol. So I know that I had a line of thought and I forgot exactly what I was going to say. Um, that's okay. I'll try and think of it. I'll get back to it. So the DSM, it's called the Bible of Psychiatry. It's now in its 5th edition, and I can't remember if the latest one that just came out a few months ago is the 5th or the 6th. 95% of the psychiatrists that contributed to this had financial ties to the pharmaceutical companies. Um, the National Institute of Mental Health has actually withdrawn support of the DSM-5 due to its what they say is a lack of validity. Unlike our definitions of heart disease, AIDS, things like that, the DSM diagnoses are based on a consensus about clusters of clinical symptoms. Um, they just say that there's really no evidence to back this thing up, the DSM. And that's just another quote that I found directly from some pretty interesting articles in Psychology Today about. So the branch of psychology and the branch of psychiatry, those two branches of medicine, don't always work together. Psychiatrists, I'm sure you know, are medical doctors. They rely on drugs more. Psychologists tend to work more with therapy. They have PhDs in psychology. So oftentimes, not the people that are more prone to therapy and not necessarily jumping on the drugs right away tend to be psychologists. This is some of the changes in the recent DSM-5 update. Grief is now considered a mental disorder. So if you're grieving for too long, it's considered a mental disorder. Adult ADHD, of course, they're really making a lot of money off that one. And of course, some adults have a lot of issues with ADHD, but there are other ways to tackle them. First-time substance abusers will be lumped in with hardcore addicts. So obviously, hardcore addicts, that's a serious issue. But somebody goes out and they're maybe 18, 19 years old. They go out and get drunk a couple times, and now all of a sudden they have a mental illness. Behavioral addictions. And this is a quote here. Except for autism, all the DSM-5 changes loosen diagnosis and threaten to turn our current diagnostic inflation into diagnostic hyperinflation. I'm sorry, I apologize. The quote, the reference there got cut off. I'm sorry about that, but that was in another article from Psychology Today, and feel free to kind of read through that as well. Rate of antidepressant use in the U.S. increased by 400% since 1990. About 10% of the population over the age of 6 is currently on the drugs. So we already took a look at the 60 Minutes piece on the viewpoint of Irving Kirsch and antidepressants. The biggest category is women, Caucasian women age 40 to 50. That's the biggest category of people that are on antidepressants. And it's a problem with people taking antidepressants and not getting therapy, of course. So placebos, just for those of you that may not be familiar with these, I know they talked a lot about placebos in the study, in that 60 Minutes piece. So when they are testing a drug, when it goes through a clinical trial, they take a large group of people, say if they're testing uh, for cardiovascular disease or high cholesterol, let's say, and they want to see if this drug works against high cholesterol. Take a large group of people with high cholesterol. Half of them get the real drug, the other half get a placebo. Nobody knows who's getting the real drug, who's getting the placebo. The researchers don't know who's getting the real drug and who's getting the placebo, and then they just follow these people for a couple weeks, and they see if the cholesterol rates go down in the two groups, and hopefully the cholesterol will go down further in the people on the real drug. And if they do that, then they can sell the drug. So it's called a placebo-controlled trial. And what we saw was that the antidepressants are no more effective than placebos for the most part, which means that they don't really work. Any effect, any benefit that you're getting from taking a placebo or from antidepressants, according to Irving Kirsch and some other very well-respected psychiatrists, any benefit is oftentimes the placebo effect. So again, that's for mild to moderate depression. Again, this is, you can kind of read through this, but basically what they found was that large systematic reviews found that these drugs were really no more effective than placebos for most of the people that are being prescribed these drugs. And of course, we saw what happened in England. Um, it's not necessarily that the serotonin theory isn't true. It's just that it's a gross oversimplification of a very complex problem. Think about what they're suggesting. You know, your diet doesn't matter. The fact that you get no exercise doesn't matter. The fact that your parents are going through a divorce doesn't matter. The fact that you're going through a divorce doesn't matter. The only thing that matters is that you have low serotonin in the brain and you need to take this drug every day for the rest of your life. Like that's kind of silly if you think about it. So David Healy, he's a psychiatrist was involved in the clinical trials for, I think it was Paxil, the antidepressant for GlaxoSmithKline, and he found that during the studies that the drugs weren't working, and he told GSK, and they ignored him. So he left GSK, and he still does use antidepressants in some of his patients, but he says the use of antidepressants is they're grossly overused. And he says, this is a direct quote: the serotonin theory of depression is comparable to the masturbatory theory of insanity. They used to believe that masturbation caused insanity. And the idea that low serotonin causes depression is kind of comparable, at least according to Dr. Healy. He's got a pretty cool website. Check it out. Just Google Dr. Healy's name. He goes through, he documents every known case of school shootings that resulted, or at least the school shooters were on antidepressants or some other psychiatric problem. Not just school shootings, but massive, like pretty significant issues. And he's got everything very well documented. And again, he still uses the drugs, but he uses them in very small doses and for very short periods of time. So again, Irving Kirsch found that the antidepressants really, for the most part, are no more effective than placebos. And again, he's a doctor. He has other techniques of dealing with depression, holistic techniques. These are just some information about tricyclic drugs. They were the class of drugs before SSRIs. Some additional information about antidepressants. There's concern about increased risk for suicide. Just be careful. If you're on the drugs, just be careful. The biggest concern is going off of the drugs. That's when people really seem to have issues. So if you're on the drugs and you're choosing to get off, or if you know somebody that's thinking about getting off, definitely get help. As far as kids go, I know I wanted to say earlier about the doctors. So the way that the FDA works is that they will approve a drug for a certain use as long as there's evidence. There appears to be evidence to support that drug can be used for that use. The drug companies are only allowed to advertise, when they advertise on TV and in commercials and things like that. They're only allowed to advertise the drug for that use. They can tell a doctor that the drug can be used for anything, and a doctor is allowed to prescribe a drug for anything, any drug for any reason. They do not need to go by the results of the clinical trials. So if a doctor thinks that an SSRI is going to be helpful for kids, regardless of whether or not there's evidence for it, a doctor can put a child on those drugs. That's just the way the system works. So, and sorry for that 5 minute rant there, but that was kind of where I wanted to go here. This is why kids are being put on SSRIs, because the drug companies convince the doctors that they work, that they're very effective, and that uh, there's no adverse effects, and obviously there are. Um, uh, Prozac did seem to work for a while, but then some other studies found that it's probably not as effective as they first thought. So, and of course, there's issues with Prozac as well. So, they put a black box warning on these drugs now, saying that there's an elevated risk of suicide in children that are on these drugs. So, some of the additional side effects, almost most of the people have some type of sexual dysfunction. 70 to 80%. A lot of people gain weight, insomnia, diarrhea, nausea, and then the withdrawal is when some of the issues. I mean, because you're taking a pretty heavy, a pretty powerful, neurochemically altering drug, and when you go off of it, your brain starts to become dependent on it essentially. Um, there's for the most part, the overall, I'm not saying they should never be used, but first line therapy should be making sure they're getting enough sleep, getting enough exercise, eating a very healthy plant-based diet, have consistent parenting. Obviously, that's can be an issue in a lot of situations. Um, stress management techniques, problem solving. Uh, and then, if that doesn't respond, group cognitive behavioral therapy. It's kind of expensive, but it can work. It can be really effective. And again, not everybody has the opportunity to do that. I understand that, but if you have the finances or if you have insurance, it can get covered. It can get covered. If all that doesn't work, then you can use the drugs. But you shouldn't just put a child on a drug and just uh, hope for the best, essentially, without kind of considering all these other issues. CBT, again, we talked about that already. Um, Pretty effective, but it's also expensive. So again, the best approach: CBT, healthy diet, plenty of exercise, and find out what's bothering the kid. It could be something in the environment. Again, exercise is probably just as good as any drug out there anyway. So you might as well just do the drug. Or excuse, you might as well take the drug. It's a lot easier than exercising. You might as well just exercise. At least as a start, and of course get help too. Harvard found, of course, that eating a Mediterranean style diet like theirs can reduce risk of depression. Um, St. John's Wort is pretty effective. If you're on a drug, if you're on antidepressants, you don't want to mix the two. But if you're thinking about taking anything, you might as well try some organic St. John's Wort. It can probably help. Again, for mild to moderate depression, it's not going to work for major depression. Acupuncture can probably help. Again, any type of exercise is going to help. So yoga, of course, is going to help. Um, Acupuncture can probably be helpful. But again, it's not no magic bullets, right? It's a combination. It's you approach it from multiple fronts. As far as bipolar disorder is concerned, there was a 40-fold increase in the diagnosis of pediatric bipolar disorder over a 20-year period. That's not even 20 years. That's 10 years. Um, and it was because doctors were aggressively applying the diagnosis to children. Um, there was a doctor, his name was Biderman, Joseph Biderman. He went around the country talking to all these doctors, giving all these lectures about pediatric bipolar disorder and how it's a chemical imbalance and you need these drugs. Well, he was being paid by the pharmaceutical companies to do that. He got millions of dollars from the pharmaceutical companies. The drugs are very expensive. They're much more profitable. They're very profitable, I should say. But it's caused a surge of usage in antipsychotic medication. Um, it's increased significantly across all age groups. Again, children as young as 3, 4 are being put on these very powerful drugs. So you can look at some of the increases there. Risperidol, I can't even pronounce it. Seroquel. A lot of times when they, people like alcoholics, a lot of times when they stop drinking, they think that they need something like this, it might be helpful, of course, but I should say that. But there's a lot of side effects, of course. I've seen on the commercials now, gynecomastia. I don't know how to pronounce that. Sorry, it's breast enlargement in boys. It's when boys start to develop breasts. Um, and it's unfortunate, but it happened. In fact, it happened to a guy that I know, a guy that was a year ahead of me, because he didn't tell us that he was on what drug he was on. He told us he was on a drug, and he developed this problem. Um, I'm gonna. You can push pause and read through this. I'm going to ask you to read through this. It's just some information about uh, uh, the antipsychotic drug Zyprexa, and this information comes from Robert Whitaker's book, which I highly recommend. Um, again, ADHD, we already talked about this, so I'm not going to talk about it too much more, but there's probably some issues with this being overdiagnosed. And then some of the issues with the medication, some of the concerns with the medications. Initially, when they first started doing these studies, they had two groups of people, and one group was on medication, the other group went on therapy, and the group that was on the medication did better, as far as I guess test scores and probably some other measurable. Uh, 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 some things that they were measuring, and so right away everybody kind of jumped on the medication bandwagon, saying that that was the best way to go. And it certainly is a way to go. I don't know if it's the best way to go. There are other ways that we can that we're going to take a look at. So, um, there's some issues. There's some pretty interesting information about this placebo effect and ADHD medication. You can read through this, especially when they're in the teachers and the parents. So when they gave kids a placebo and they told the parents that they were actually taking the drug, the parents and the teachers both kind of evaluated and judged the children in a different way, which is kind of interesting. And there was no changes in the children, and they were just the fact that they were taking the drug every day, they were judged differently. So exercise, of course, very important for ADHD. Um, there does seem to be an effect. Swimming is a wonderful form of exercise for anyone with ADHD. Um, it's probably it's not going to work. It's not a magic bullet. It's not going to work the same way that the drugs do, but exercise can be very, very helpful. Um, I would say limit screen. You should limit screen time anyway, but for everybody. But you need to be careful with kids with ADHD and autism, because they tend to get fixated on screens. So the classic symptom is a kid that can't pay attention in class or can't read, but can play video games for 6 hours a day. Again, there's a concern about substance abuse and gambling addiction for people with ADHD. And there's some concerns about the long-term medication outcomes. So again, feel free to read through this, but basically it seems to elevate risk for long-term problems, social and physical problems. So again, I think that there's probably some alternative approaches that are probably a little bit safer in the long run. Um, Again, the medication is probably more beneficial in the short term, maybe, but I think in the long term, I think the natural remedies are probably better off. Um, Again, a lot of issues with medication side effects. In fact, if you look at the ADHD medication effects and compare that to there's like a checklist for bipolar disorder, and if you compare the two, they're almost identical. The part of the increase in bipolar disorder is really people on antidepressants or ADHD medication that start to develop extreme side effects to the long-term use of the medication. And the doctors will try and tell them that what they're seeing is the disease progressing, and it's not. It's called iatrogenic disease. It's disease caused by a medical intervention, and it's really unfortunate. So we need to be careful. There's some issues, obviously, with ADHD and medication abuse. So you can feel free to kind of take a look at this. Um, it's again, it's a uh, it's an amphetamine. It's speed essentially. So of course people are going to abuse it. And then I don't have a lot of information here about schizophrenia, but just some interesting kind of quick notes. Wheat gluten actually seems to trigger issues in schizophrenia. Schizophrenia and celiac disease are very similar genetically from a DNA standpoint. You should if I don't know. Schizophrenia is pretty rare. It's like 1%, but they need to be careful with dairy and wheat. Obviously, stress is a big problem for schizophrenia, but diet is really important. exercise can help. Well, part of the issue is that people diagnosed with schizophrenia, they think they need to. Some people in the medical system think they need to be on medication permanently, and for some people that's probably true. But for people, they found that people with schizophrenia, they have breakdowns essentially, or schizophrenic episodes, and they need to go to a quiet kind of retreat essentially, or home, and get through their issue, whatever it is, and it might take a couple weeks or it might take a month, and then once they get through that, they're able to kind of get back and back into the swing of their life. Diet obviously is extremely important. Part of the issue when they medicate schizophrenics is that they can't move; they're physically inactive, or it significantly decreases the amount of activity that they get in a day. So this is the group that tends to have a life expectancy of about 25 years less in some cases than schizophrenics that are not medicated. So they can do it, and there have been some really successful programs. Unfortunately, the mainstream adoption has been long-term use of medication. Uh, so there does seem to be some holistic approaches that seem to be pretty effective. Um, and obviously they're not going to be effective all the time, and they're going to have some issues potentially, but they seem to be pretty beneficial, or excuse me, they seem to be pretty effective, rather. Okay, so that's all I have for this one. Hopefully this wasn't too depressing, and you got some information out of this. And then we're going to talk about neurodiversity. It's kind of a different approach. Thanks.